Congressman, we have an email question from James in Patterson, California, who wants to know why are healthcare costs going up so much, and what can we do to stop these increases? And could I just add a question to that? Because in the framework of a single-payer system, people say the consequence of trying to contain costs in a single-payer system would ultimately be rationing. So could you take us through first how a single-payer system would address costs, and also what you say about these sorts of concerns that people raise about it?
You know, think about this now. The insurance companies, when they look at a single-payer system, a not-for-profit system, they'll say, my God, you're going to end up with rationing. What do we have now? 46 million Americans don't even have coverage. Talk about rationing? They're not even in the line, okay? Give me my portion. No. Another 50 million people don't have any coverage, are underinsured, and the rest are paying these high premiums, copays, and deductibles. We got to break the hold the insurance companies have. And their public relations operations will say, well, rationing. The fact of the matter is, this plan that I'm talking about covers everyone. How do you reduce costs? Let's look at the costs that are involved in the system right now. Corporate profits, stock options, executive salaries, advertising, marketing, the cost of paperwork. All this takes about 31% out of the healthcare dollar. Now, what does all that have to do with healthcare? Zero, zip, nada. I'm talking about creating a system which, by the way, is similar to that in every other industrialized nation in the world. We take the profit out of medicine. Healthcare is a right, it is not a privilege. So how do we control costs? By having everyone in the same pool, everyone, having everyone covered, and having the benefits be available to everyone, whatever their income, no means testing, and by creating a movement. Now, I want to add something to an earlier question you raised, and that is that, and my good friend Senator Edwards, who he and I campaigned together 4 years ago, he raised this question, which is which is the question in Washington. Well, it's just not feasible to take this plan for not-for-profit health care. Senator Clinton talked about challenging insurance companies, but doesn't really get to the ultimate challenge, and that is who controls health care in America. Senator Obama is still developing his plan. This plan that I'm talking about, I co-authored this plan. I'm one of the ones who wrote the plan. I know the way this system is set up. The area that I represent in Cleveland, people are losing their homes because they can't pay the doctor bills. And so the question is, what it ultimately comes down to is who has the courage and the willingness to take a stand and can reach out to the breadth and depth of the American people and call forth our greatness to say we're going to change this. We're not going to be trapped by these insurance companies who give us diminishing returns, who insist on higher premiums, copays, and deductibles.
Thank you. Congressman, you're kind of an urban kind of guy. And Ashley Osborne, who is a labor and delivery nurse in Elko, which is a rural county in northern Nevada, has a question for you about how you would address concerns in people who are in her situation.
Good morning. As you know, my name's Ashley Osborne, and I'm a labor nurse in Elko, Nevada, which is a rural area up in northeastern Nevada. And commonly I see moms come in to my department with severe pregnancy-induced healthcare issues that could be eliminated or caught early with prenatal care. Unfortunately, they are unable to get that. What are your plans on improving healthcare in the rural area in the U.S.?
Well, first of all, this plan covers everyone, and rural as well as urban areas alike. Rural areas tend to be underserved. I'm looking also at creating an infrastructure program to create millions of jobs, rebuilding America's infrastructure, which would build hospitals in rural areas. And rural people would then have access, because access is the huge question in rural areas. And when you talked about women being able to get the care they need, this system, prenatal care, postnatal care, now I have a plan for child care. This system of not-for-profit health care doesn't try to stop women from getting the care they need because there's an insurance agent telling a doctor, you know, an OB/GYN doctor, said, well, you just can't do that. You're asking for too much. This system will meet the health care needs of the American people. We're being told we just can't have those needs met. We've got to start thinking differently. Does that answer your question? Thank you.
Thanks. And now I would like to turn to a public health student here at UNLV, Megan McCormick, who raises a pertinent point. If there's any place where you're interested in outcomes, it's in healthcare. Megan?
Hello, right here. I'm Megan McCormick. I'm a junior at UNLV here. We're spending an increasing percentage of our gross domestic product on healthcare while we continue to have poorer outcomes than those countries who are allocating a lower percentage of their GDP towards their own healthcare. How does America plan to stay globally competitive with increasing healthcare costs?
You know, that is a key question. I mean, in my own congressional district, we have auto plants that have been threatened, and others across the country have been threatened, because the high cost of health care is causing Ford and GM to pay billions of dollars of health care costs. Now, Canada, on the other hand, has a much stronger industry because they have a health care plan for their people. This plan that I'm talking about is going to help American business. It's going to strengthen the economy. It's going to make it possible for individuals to be able to hold on to more of their money. It's true that many families right now are spending in excess of $10,000 a year for health care. With this plan, only a fraction of the money that is being spent right now would have to be part of the financing of the system. I mean, do you know that 60% right now of the money that's in health care is spent by the government? The government has 60% of the spending right now. If you eliminate administrative costs, if you bulk purchase of drugs, just the way Veterans does, you start to come up with the money that you need to provide coverage for everyone, and that is a major help for small businesses and large businesses alike. This patchwork proposal that you've been given here today by other candidates locks us into insurance companies who then take their pound of flesh, and generally it keeps people from being able to have any control over their own budgets. I want to go back to what most American people are experiencing: economic uncertainty because of the way the healthcare system is set up. People are aware, no matter how much money they have, that if they have an illness in the family, it could wipe them out. Who isn't going to make the choice to take care of a loved one? You do what you have to. But why, I would ask you, should someone have to lose their home in order to ensure the health of a loved one? Why should someone not be able to get the long-term care they need for a loved one, or have to sign on the dotted line to give away everything you've worked for a lifetime in order to get the long-term care you need? See, what I'm talking about is a real transformation. I think the American people are ready for that, but they need someone to be not just the messenger, but someone who knows this issue and is ready to stand up and speak out. Yes, we can improve our economy and save our businesses large and small, and I'm dedicated to do that, and I'm able to do it too. Thank you.